Healthcare spending in California is about to become the center of a heated debate, as one of the nation's largest unions takes action to reshape how hospitals and clinics allocate their budgets. The Service Employees International Union, SEIU, specifically its healthcare branch, is spearheading an effort to introduce two groundbreaking initiatives on the state ballot. These measures aim to impose new regulations on hospital and community clinic spending. But not everyone agrees that this is the right path forward. And here's where it gets controversial. While the SEIU argues these changes are necessary to prioritize patient care, critics warn they could create unintended challenges for institutions already grappling with financial pressures. At the heart of the issue is the question of accountability. Renee Saldana, press secretary for SEIU United Healthcare Workers West, emphasized the union's goal of ensuring that healthcare dollars are spent wisely. Ultimately, we want to guarantee that money intended for healthcare is actually being used for healthcare, she explained. But defining what qualifies as healthcare isn't so straightforward, and that lack of clarity has sparked concerns among industry leaders. One of the proposed initiatives would require federally qualified community clinics to dedicate at least 90% of their annual revenues toward patient care. Sounds simple enough, right? However, the initiative doesn't specify which expenses would count toward that threshold. Saldana acknowledged that the union hasn't yet outlined precise guidelines, but suggested that funds should primarily support direct services, such as paying healthcare workers, rather than executive compensation or unrelated projects. But here's the catch. Many clinics provide essential services that may not fit neatly into the category of patient care. For example, some community health centers employ large teams of translators to assist immigrant patients who face language barriers. Others run street medicine programs, multidisciplinary efforts involving doctors, nurses, social workers, and outreach specialists that deliver care to unhoused individuals. Francisco Silva, president and CEO of the California Primary Care Association, pointed out that much of this work wouldn't meet the narrow definition of patient care under the proposed rules. We'd either have to eliminate these vital services or face penalties for failing to comply, he said. This raises important questions. Should all aspects of community well-being be considered part of healthcare? Or should clinics focus solely on traditional medical services? The second initiative seeks to address another hot-button issue, executive pay. If passed, it would impose salary caps on hospital executives, limiting total compensation for administrative, managerial, and executive roles to $450,000 per year. Future increases would be tied to inflation, measured by the Consumer Price Index, but capped at no more than 3.5% annually. Proponents argue that excessive executive pay diverts resources away from patient care, especially during times of economic uncertainty. Critics, however, worry that such restrictions could hinder hospitals' ability to attract top talent, a concern echoed by Carmela Coyle, president and CEO of the California Hospital Association. In a recent statement, Coyle expressed frustration over what she sees as misguided policies that threaten to drive skilled leaders out of the state, as California's healthcare system braces for unprecedented challenges. It's unfortunate that one group is making it harder to retain the brightest minds, she remarked. Adding fuel to the fire, the SEIU points to looming federal budget cuts as further justification for tighter oversight on healthcare spending. Saldana warned that these cuts will disproportionately impact California's hospitals and medical centers, making it even more crucial to ensure funds are directed toward patient care. Yet opponents counter that additional regulations might strain already overstretched institutions, potentially jeopardizing access to care for vulnerable populations. With both initiatives set to enter the signature gathering phase this fall, Californians can expect a lively discussion in the months ahead. Supporters frame the proposals as a necessary step toward greater transparency and equity in healthcare funding. Detractors, meanwhile, view them as overly restrictive measures that fail to account for the complexities of modern healthcare delivery. So, where do you stand? Do you believe stricter controls on spending are needed to protect patients, or do you think they risk doing more harm than good? Share your thoughts in the comments below. Let's keep the conversation going.